Welcome to Coffee and Tea with AARP, a bi-weekly program in which AARP staff and volunteers speak with statewide experts on topics that we think are going to be interesting to AARP members. This month is November, which is National Family Caregivers Month, and we are really excited today to be joined by two great folks. First, my co-host today is one of our fantastic AARP Connecticut volunteers from Stamford, Malinda Polite. Hey, Malinda.
Hello.
Great to have you with us today. Thank you for everything you do for AARP and for being with us today. Also, I'm really excited to welcome to the program Claire Cote, who is a field representative with the State Department on Aging and Disability Services. Hey, Claire.
Good morning. Howdy.
Really excited to have you here today. Claire and I have participated in a couple work groups together and always been really impressed with her expertise and the passion that she brings to her work. So thank you for taking the time to be with us to talk about family caregivers.
Sure. Likewise, Anna. I'm happy to be here, and it's great to meet you, Malinda. Thanks for all the work that you both do.
Thank you.
Yeah, so let's jump right in. I think we have a lot of really good information to dig into today. So Claire, just to kick us off, can you tell us a little bit about yourself and your role at the Connecticut State Unit on Aging and Disability Services?
Sure. Thanks. Well, I was a lady that I was born here, born, raised, and educated here in beautiful Connecticut. I myself come from a family of helpers as well as formal and family caregivers. My mom's a nurse. Dad worked at the Institute of Living in Hartford for over 30 years. They both were definitely a little bit of the inspiration for both my sister and I to go into helping professions. She's a guidance counselor here in Connecticut Public High School, and my background ended up being in social work with concentrations in policy, psychology, and gerontology, which is the study of aging. When I first started working, I worked in many different capacities at an assisted living facility for about 8 years. Then I hopped over to the public sector and haven't really looked back since. Currently, I've been with the State Unit on Aging, which is a small but mighty division of the Aging and Disability Services Department, for about 3 years. I started in 2019. In that time, I've had a lot of opportunities to wear many different hats, as all of my colleagues do. And currently, I support several initiatives, one being the anti-ageism campaign as a reframing aging facilitator. I also have the honor of liaising with municipal agents and senior center professionals across the state of Connecticut, and I'm the current acting statewide coordinator for both the National Family Caregiver Support Program as well as the Connecticut State Respite Care Program.
Claire, you mentioned the National Family Caregiver Support Program. Since we're speaking during National Family Caregivers Month, could you tell us a bit more about that program? Why is it important for the state of Connecticut and the federal government to have programs like this that are targeted at that family caregiver population?
Yeah, so this is actually a federally funded program. It's administered in every single state. So every state across our nation has a National Family Caregiver Support Program, and that's funded through Older Americans Act funds, Anna. Here in Connecticut, the particular program is administered through Area Agencies on Aging, or AAAs, as we like to call them, because we love our acronyms. There are 5 in the state of Connecticut, and each of them serve residents in several towns within their catchment area. So services funded through that particular program include information referral and assistance, support groups, which are vitally important, caregiver training, as well as some really palpable supports to caregivers, including respite services, as well as supplemental purchases that assist caregivers in meeting the needs of the person they're supporting. I know we'll talk more in depth about respite later on, but supplemental purchases can be for items like durable medical equipment, incontinence items, or even technology that might be able to assist a caregiver. Eligibility can be a little bit tricky, but it's all explained on our website and on the individual websites of each AAA. Ultimately, if somebody over the age of 18 is providing assistance to somebody who is either older or younger with a disability, has some challenges with what we call activities of daily living, ADLs, which include bathing, dressing, toileting, eating, they may be eligible to receive some financial support, some supports. Any person who's in a caregiving position or assisting with someone can receive information and assistance, support through support groups and training. That's that's available to everyone. The program, which I don't think everyone knows, also supports grandparents who are providing care for their grandchildren. We fund support groups across the state and provide guidance through contracts with other agencies who are working primarily with this population every single day. It's really great. A lot of State Unit on Aging and Older Americans Act funded programs trickle down, and they're administered on the community level, whether by the AAA or by their contracting agencies. And it offers an introduction, so to speak, to like the long-term care world. So programs such as National Family are vital, not only to provide that information and assistance in communities where it's vitally needed, but also provide residents of Connecticut the opportunity to engage with local and regional professionals to whom they can connect in the future as their families' needs change. I do want to note, because we're talking about family caregivers, that the definition for family caregivers is actually probably more broad than people imagine. You don't actually have to be part of somebody's formal family system to be a family caregiver. You can be the neighbor, a church member, or an extended family member who is assisting in different capacities. Caregivers often don't think of themselves as caregiver either. I know you know this. I think that's important to note, where you may just be doing the right thing or doing what anyone else would do in your shoes. But whether it's bringing in the garbage or grocery shopping, or maybe providing hands-on care or taking someone to medical appointments, it's all valuable stuff. And you're a caregiver.
Okay.
Yeah.
You know, one of the programs that that you support is the Connecticut statewide respite care program. But before we talk about that program itself, could you tell us a bit about what respite care is and why it's important to family caregivers?
Yeah, thanks, Malinda, for the question. Respite's not a term that we use every day, but it can be equated to the term relief. If you were to look up the word in the dictionary, it actually goes so far as to say it's a break from something unpleasant. Now, I believe and I know that many folks who provide support and care to folks wouldn't necessarily consider that support unpleasant, but it can be very draining on a person to constantly or regularly be the support person to another person, regardless of how you're supporting another person and what their needs are. Respite's important in everyone's lives, but especially family caregivers. If you think of the analogy of the oxygen mask on the airline and how we're instructed to put the oxygen mask right on ourselves before our neighbors, think of it like that. It's so that we have the energy and the ability to help the person next to us. The same goes with caregiving. We so often see that folks who are continually in a position of providing care and support to others actually end up in worse physical and mental health because they haven't gotten a break and taken the time to ensure that they themselves are taken care of. Respite can take on a lot of forms. So I love that both of these programs that we're going over today can provide respite in forms that people really need. So it's unique to a person and a care recipient or a caregiver's needs. Oftentimes it can be somebody coming into the home to provide companionship, maybe do some household chores. In the case of this program, it may mean someone who's receiving care or support may be able to attend an adult day services program where they can interact with others and have a social outlet, be in a safe environment, and where their needs, both medical and physical, can be addressed. In the case of National Family Caregiver Support Program, it may look like a week's worth of summer camp for your grandchild, which I think is pretty neat.
Yeah. Okay. So what does the statewide respite care program provide, and who is actually eligible for this program?
Sure. So the statewide respite care program is specifically geared toward providing support to folks who are helping an individual who has Alzheimer's disease or a related dementia or memory loss. That memory loss really has to be irreversible and deteriorating. The program was established years ago in partnership with the Connecticut chapter of the Alzheimer's Association, and it's unique to the state of Connecticut. So not every state supports a program such as this. Statewide respite can actually support respite in the home and outside of the home. And when I say home, that could be an apartment or a house, as long as somebody's living in the community, they're not in a nursing home environment long-term. The program can fund having someone come into the home to provide that hands-on care or simply companionship, some homemaking services. When I say homemaking, like laundry, grocery shopping, cleaning, that kind of stuff. As I mentioned, it can also fund sending someone to a day program, which is a great option that encourages socialization and can also meet the medical and physical needs of an individual. Eligibility is pretty straightforward for this program, and all of the AAAs or area agencies on aging have that information available on their websites. I know we'll provide that to folks here. Caregiver has to be somebody over the age of 18, but for both of these programs, that caregiver doesn't necessarily have to live in the state of Connecticut, but the person who they are supporting does have to be a Connecticut resident. And in the case of the statewide respite program, they do have to have a formal diagnosis of Alzheimer's or another degenerative dementia. Some examples might be frontal temporal lobe disorders, Lewy body, or vascular dementias. For this program, there are income and asset limits. They're based on the care recipient or the person with the diagnosis. They're quite generous. So the current income limit for an individual is a little over $51,000 a year, and the asset limit is about $135,000 a year. The assets do not include the home you live in or the car that you drive or need to use to get to medical appointments. It's the liquid assets or the monies that are available to you. And these criteria change as the cost of living here in Connecticut changes too. It's important to note that when caregivers are looking for resources, and particularly at these two programs, they don't really have to know which box they fit into, like which program they fit into. There's a joint application for both of the programs available on each AAA website. And so long as somebody completes that, the care managers at the AAAs will follow up with you and your needs, and they'll figure that out with you. So you don't have to know exactly what you're looking for. You just have to identify what your needs are, and you don't have to be the expert on the programs, just the expert on your person.
Excellent. And I love how you phrased that.
I just came up with that.
So we're talking about a lot of different resources, most of which I think we've focused more on some of those statewide resources that are available across Connecticut. But before you started working at the State Unit on Aging, you were the Senior and Social Services Director for the town of Canton. But I know in talking to some of our volunteers, some of those local resources can be the hardest to connect with sometimes. So are there resources available at the municipal level for family caregivers? And again, 169 towns in Connecticut, they're all a little bit different. But in general, do you have recommendations for where folks can go within their own community to get some caregiver support?
Sure. Yeah, I was with Canton for over a decade, and you're right, they can be difficult to connect with, but only because I think people don't necessarily have an awareness that they're available, Anna. And oftentimes, I would connect with people out of necessity, or word of mouth was my best friend in that particular role. You're also not kidding. Every town is set up a little differently. So resources that might be, and professionals that might be available in one town might not be available in another town as well. But yeah, every town does have at least one municipal agent for the elderly, which is a go-to person for questions about aging and resources available. That's really important to know. A lot of that information is available on town websites, or if you call like the local town clerk's office, normally they would have that information. Many towns also boast senior centers or local senior services that offer programs, the fun stuff, and services that can be very helpful. So the fun stuff might be bingo and educational programs and things that encourage socialization. There might also be transportation services available both in the town and perhaps outside of the town for medical appointments. Nutrition services are oftentimes located or supported at senior centers as well. And many towns also host local social services professionals as well. Between those two entities and the municipal agents for the elderly, they have a knowledge of federal and state programs like the two we've been discussing, but many also have an awareness of other supports that can be really helpful. Some might include, so every town has property tax relief for homeowners, and they administer renters rebate program. Those are statewide programs, but they're administered on the local level. Many also have loans that can be taken out at 0% interest to help older homeowners maintain their homes. This is really great. There are things that you can do to make a home more livable as your needs change or your loved ones' needs change. There are also programs like heating or energy assistance that are often administered locally. And many of the senior and social services offices also host and support educational programs. And they work in conjunction with other town departments to provide information, assistance on a variety of topics that have to do with not only living safely, but living well in your community. I really want to encourage every person listening to not only check out what these folks are doing within their communities, get on their newsletter list, hop on their websites to see what might be available, but also check out initiatives such as the Livable Communities campaign here in the state, which is supported locally in towns throughout Connecticut, as well as an entity called the Connecticut Age Well Collaborative, whose mission is to support age, dementia, and disability inclusive communities. Very exciting stuff.
So how can Connecticut do a better job of supporting the family caregivers?
Well, Connecticut is rich with resources, Malinda, and there's a lot of information out there. Unfortunately, it's in a lot of different places, and it requires a lot of poking around to find information that's pertinent to you and your situation and your needs. So supporting and maintaining websites like My Place CT, where there's like a one-stop shop information, is vitally important. We've even started conversations about how to make the state's websites more accessible and easier to find information using language that everyone understands. So example, we've been talking about respite. I'm not using respite every day. Like, oh, I feel like I need some respite. No, I need some help. I need a break, or I need an in-home help, or I need a meal delivered, something like that. So really using accessible language is important. Supporting and encouraging communication, collaboration across private and public sectors is really important. Happy to have AARP as a partner in that, so that when a caregiver or someone needing care or information finds a resource, whatever that resource may be, that they're kind of wrapped around and they're supported through their process and their changing needs. We call that a no wrong door approach here in Connecticut. And of course, we've been talking about informal caregiving this whole time, family caregiving, ensuring that the folks providing the formal services are taken care of as well is extremely important. So in Connecticut, there are initiatives to support paid caregivers, as well as to bolster that direct care workforce that is so needed to ensure family caregivers do have respite even available to them. Reaching out to and making materials understandable and accessible to historically underserved communities is really a goal as well. Proper translation, representation within programs, and specialized outreach projects are necessary in order to engage these folks with varied backgrounds and levels of understanding, and abilities to work with government too. You know, we need to bring things down to an accessible format for individuals within our communities.
What do you see as our greatest areas of unmet need?
So Malinda, thanks for asking. I really feel that ensuring that we're reaching out to and making materials understandable and accessible to historically underserved communities is important, and more important as the fabric of our communities change and change for the better. So proper translation and representation within programs and specialized outreach projects are really necessary to engage folks with varied backgrounds and levels of understanding.
Okay, very good, very good. So what do you think is the most important message for family caregivers to hear during the National Family Caregivers Month?
Well, I would say that they should be hearing this stuff year round, but specifically for this month, I think number one is thank you. I think you are seen, we hear you, we couldn't do it as well as you can. You have value and you are valued. We're trying to make it better for you. We know it's not easy and you don't have to do it alone. So those were several messages, but if we can emphasize those around this time of year, especially as folks are getting ready to get together for holidays and other special occasions and going into the new year, I think those are vitally important to hear this month and throughout the year.
Yeah, those are all really important messages. And you mentioned a couple times, throughout this conversation that caregivers oftentimes feel unseen and might indeed not even recognize the role that they're playing as a caregiver.
Absolutely.
So before we wrap up, I just want to tap into Malinda's experience really quick here as an AARP volunteer. We're one of the volunteers that provides a presentation on behalf of AARP Connecticut called the Caregiver Roadshow. Could you tell us a little bit about this presentation and who the target audience is and how folks can maybe learn more about this?
Certainly, the Caregiver Roadshow is really a comprehensive presentation that provides information for the caregiver and for the care recipient. It provides useful resources for every area of need and also gives information in how to find those resources, which we feel is really critical. The presentation offers tips for planning and also the benefits of planning, because many individuals don't realize how really critical and how really important it is to plan early on and not to just wait for something to happen, but make sure your plans are in place. Also, there are tips to help the caregiver feel better connected. We also emphasize self-care. We realize that in many cases, caregivers really do not focus on how critical it is or how critical self-care is. The caregiver is so focused on providing for the care recipient, sometimes the caregiver really forget about themselves. So we emphasize the importance of self-care. And I said it was a comprehensive presentation, and it is. We touch on Medicare, we talk about home care program for elders, we touch on help for veterans and their caregivers. We even talk about respite care and support for peoples with Alzheimer's and dementia. It's a very comprehensive presentation.
Great. Thank you, Malinda, both for that explanation and for the work you do to present that out in the community. And if folks want to learn more about some of AARP's caregiving resources, we have a very, very extensive caregiving website at aarp.org/caregiving. From there, you can drill down and find some Connecticut specific resources as well. So Malinda, thank you so much for being with us today and for doing AARP volunteer work so many days throughout the month and throughout the year. And thank you also so much to Claire Cote for being with us from the State Unit on Aging at the State Department on Aging and Disability Services. This was such a fun conversation, and thanks for everything you do to support family caregivers.
Thank you, Anna. Thank you, Malinda. It was great.
Enjoyed the participation.
Yeah, thank you.
Great, thank you. And you can join us every other week here Thursdays at 9 a.m. for coffee and tea with AARP Connecticut. Hope to see you again soon. Thank you.